Good afternoon. I think it's still the afternoon. Coming back to you again, Dr. Littell, I just wanted to spend a few more minutes helping those of you who are out there who are planning to go back to work or back to school, or perhaps back to school to work, or even wondering if you can get back into your church or any other setting. I want you to please for a second reflect on the fact that when I'm talking to you now and I'm paying money, I'm still paying for this, right? Yeah, I am. I'm paying money to get these YouTubes out to you because in my heart, I know that you need to hear this stuff. You see, I listen to stories every day of patients who've been going through this for months. And I'm crushed. I'm crushed to hear the stories of nursing home residents who've been denied the right to see their husband of 65 years, their son or daughter, when housekeepers and dietary personnel have been in and out of there. And this other family member who's their advocate has been denied the right to see them. So I have been actually writing letters for people who need to get to see their loved ones. I say, this Mrs. Smith, for medical reasons, must see her husband. And I underline that. I say, please call me with any questions. Because these patients are basically languishing in these nursing homes, isolated. The same goes for hospitals that are still continuing to deny the right of patients to have their advocates sit next to them and advocate for them. All right, so as you think about going back to school and work and church, this is a wider context of what I see as very irrational and certainly just they're not lacking, it's lacking compassion. It's lacking compassion. And I think the reason it lacks compassion, these guidelines that the CDC and the epidemiologists are coming out with, I had an article here about 500 epidemiologists talking about how they don't think anyone should get back to normal until 2021, is I believe that people have forgotten how to listen to the stories. Again, this is mentioned in this book, Love Your Enemies. It says, among other things, no one has a lock on the right ideas when they're exposed to real lives, all right? You really see that everyone has their right ideas, and then you realize that, hey, there is no right or wrong until you start listening to the stories. You say, oh man, for this person, this is the right thing to do at this time. That is why I'm a family doctor. I listen and react to the situation. I don't listen to a protocol, I listen to a patient, okay? We have to listen to patients. How is telemedicine and virtual medicine doing that? I don't know. So how is remote learning going to do that with children? How many teachers have told me they can't connect with students? Look at all these students with ADD that I treat. How can you eliminate the personal relationship with that incredible teacher that has a bond with that student who's got incredible potential and do that remotely? And then you're going to put a mask on this kid who fidgets all the time anyway? It's going to be off in 3 seconds. So as I ask you to get back to normal in this country, remember I'm doing that against a backdrop in which during the last 4 months, I've had no patients, thanks be to God, die from COVID, but I've had many patients die from other conditions that we are forgetting, completely forgetting. I had a patient with metastatic cancer who thought she had COVID, didn't seek out treatment, didn't want to leave her home. By the time I saw her, well, she died in 3 days. Didn't realize her disease had metastasized. Another patient I'd seen lost his job, was going through a troubling marriage, had all the issues that all of you are dealing with, took his own life. These issues with mental health and people neglecting themselves because of this irrational fear that I discussed in my very first video are real. They're real. And let's know as a society that it's imperative that children return to school. So let's talk about going back to school, all right? Don't ask kids to wear masks. Unfortunately, our school district just recently said the kids will have to wear masks when they're in the hallways and only in the classroom if they're within 6 feet of each other. Well, how is a teacher going to monitor that in a first grader, second grader? What are we asking our teachers to do? Teachers should be up in arms. All right, doctors should be up in arms, patients should be up in arms, because all of this is destroying the fabric of our society, and education is, in fact, the fabric of our society. public or private schools. So kids need to go without masks because they're no threat to each other and they're no threat to anybody else, to be honest. They're not a reservoir. Now, should we be sending kids to school who have a cold and a cough and a fever? Clearly not. We're changing all that for everything. Work, church, you know, the hairstylist I talked about in the previous video, she was working for 8 days with a cough and a cold and a fever. She should, especially in May when everybody in the world knew about COVID-19, but she's a hero because she wore a mask, okay? Asking kids to continually wash their hands and walking around spraying them and putting gel in their hands is just plain ridiculous. This is not a disease that's being spread through handshakes or kids touching each other. All right, or anybody for that matter. If the kid comes in and is sick and coughing and whatever all over the place, yeah, you need to clean up just as we do in the doctor's office, all right? You know, this is the reality. So you want the kids to be there in a normal environment. The social distancing for kids also, honestly, ridiculous. And when I say kids, I'm talking up to high school. College is a bit of a different story. Kids can remotely learn. Kids who are sick in college can't go home and be around their immunocompromised parents, because that's been found to be a vector for disease of transmitting. So I'm asking really all of you to consider appealing to your school boards. If you're a school teacher, I'd be happy to respond to anybody who wants. I'm doing this, by the way, based on medical facts about the transmission of the disease. I'm not going to sit here and bore you with all the data that shows that children do not harbor COVID-19 to any degree significant enough to transmit it to an adult and kill them, all right? And nor can they give it to each other in any degree to kill each other or make them critically ill. They're going to have a coronavirus type illness, cold illness, not COVID-19 serious illness. All right, same thing would go for church. I see people wiping down everything in the churches as though everybody touches everything and you're going to die because you open a door or touch a pew. Ain't happening. I'm okay with people distancing in churches. The mask wearing should be, right now, guys, here's the number one reason I get for mandating masks in churches and schools and in Walmart, and why people are going up and saying, please, sir, put your mask on. Well, that is it. You know why? Because people are afraid. People are fearful. So I have people telling me, Dr. John, I really have to make everyone wear a mask because if someone comes in without it, other people will be afraid. If they walk into a church without a mask, people are going to think, oh my gosh, this guy's going to kill us, just like he's a mass murderer. This is happening. That's what happened to me in Dunkin' Donuts this morning. I was like a mass murderer because I stood in Dunkin' Donuts, God forbid, without a mask and by myself. This is the society we live in right now, guys. Wake up. It's only going to get worse. The civility has gone down. We have a culture of contempt. We have a culture in which everyone has this bias against anyone who has a different opinion. Is it politically motivated? Is it economically motivated? Or is it motivated by some other factor that's cosmic, that's spiritual even? You can go all day with this, but please, let's use common sense and compassion. I've been saying this all along. We have not lost the ability to be common. We don't have Americans running around that are idiots. All right? And we shouldn't be calling each other idiots and jerks if you don't wear a mask. So getting back to the cold, hard facts about school, kids should be kids and they should play and they should interact as normal as they can be. If you're a teacher who's immunocompromised, you might want to wear a mask, huh? If you're sick, you stay home. And for people who are testing positive, I heard of schools where they want to test everyone before they go back to school. That is the teachers. Bad idea. Positive tests are just plain meaningless. They have no significance whatsoever unless the person is sick. So will you quit getting these tests and mandating tests for people who are not sick? You're not going to know what to do with this. Just like I talked about the race car driver who stopped racing because he had a positive test. You want to have people stop working because of false positive tests? I had patients in the hospital waiting to go home with 2 or 3 positive tests, and everyone knew they weren't contagious. They just couldn't get the dang test to become negative. All right, this is what we're dealing with. So I ask you in closing, I think I've already said this, common sense and compassion. And please, don't go telling me that I'm politically motivated. I got doctors in town here saying that. No, I'm not doing this for politics. I'm doing this because I love my patients. and I'm advocating for them. And if you choose to listen to these YouTubes and share them, then feel free. It's a free country. At least I think it used to be a free country. You used to be able to express your views in the newspaper. I was rejected by all the local newspapers from Orlando to Jacksonville because they said my views did not agree with the CDC. I'm talking in the editorial page of a newspaper. We would not have been America if people couldn't have differed with their views in the newspapers and discussed the pros and cons of this society and how we should live as Americans. So I'm appealing to each of you, this is the time to exercise your right to freedom and independent thinking, make informed decisions for you and your family, and you'll sleep a heck of a lot better at night, which goes a long way towards better health. God bless you all. God bless America. Thank you.